Hi, my name is Corinne Bowen, and I'm the Director of Counseling. I want to welcome you to our Community Forum on Mental Health. I'm pleased to be a part of this endeavor in partnership with the District Counseling Program, Social Emotional Curriculum Developers, Family Engagement Team, and Community Mental Health Partners. The district has developed another series of forums to inform, support, and empower families on issues of mental health. Today will be just one of the many series of forums that we will be delivering to the community this year. We will focus and present on a different mental health topic each month. Today, our topic will be on how to support my worried, anxious student. Our goal is to equip our parents with information about anxiety, the signs to look for, and more importantly, where to get help. Mental health continues to be the top concern for many families as we face unprecedented times and unexpected hardships in this pandemic. Before I introduce our fabulous presenters, I wanted to remind the community that Q&A is open and you're welcome to submit your questions there throughout the presentation. We will also have a brief panel discussion at the end of the presentation. During this panel discussion, you will be able to hear responses from an elementary counselor perspective, as well as responses geared towards parents with middle school and high school students. At this time, I'd like to tell you a little bit more about our wonderful presenters. Jared Taylor has been in the Bellevue School District for about 24 years. He started as a school psychologist at Highland and Tillicum Middle School. After 5 years, he switched to working as a behavioral intervention specialist and worked across the entire district supporting students with challenging behaviors. During this time, Jared went back to school and earned his doctorate in special education with focuses implementation science, educational research, mental health interventions, and leadership. Jared is currently the coordinator for the Behavioral Intervention and Mental Health Services. In this role, he leads the mental health assistance team, coordinates the Signs of Suicide program, and provides behavioral consultation and coaching, and works in the mental health advocacy. Our second presenter is Lane Barker. She is a mental health assistance team counselor and school psychologist, currently working at Bellevue High School. She has worked with students from preschool through high school over the past 9 years in Bellevue. She's been working over the past 9 years, in Bellevue School District. She's a mom to 2 feisty kids, a 3.5-year-old and a 1.5-year-old. And then last but not least, our third presenter tonight is going to be Carol Johnson. Carol has over 20 years of experience working as a school counselor at both the middle school and elementary school level. This is her 6th year in Bellevue School District, and she's currently working at Spirit Ridge Elementary. She's also a mom and is navigating challenges, like many of you, of remote learning with her own middle school and elementary age students. At this time, let's go ahead and get started on our presentation.
My name is Jared Taylor. I'm coordinator of behavior interventions and mental health services. And later joining us will be Lane Barker, who's a mental health assistance team counselor. And we're here to present tonight some strategies to how to support your worried or anxious student. Before we jump into the main content today, I want to go over what we're going to cover. First of all, the 4 main topics are: we're going to define anxiety and stress, what it is. We'll talk about the prevalence of how often it occurs and when it becomes a challenge. We'll talk about some of the causes, and then we'll talk about some strategies that you can do at home to help your child, as well as what the school can do in the community. I do like to spread a little bit of humor through my presentations, especially for such challenging and difficult topics. I think sometimes humor can be a helpful cure or kind of respite for anxiety and depression, so I try to do that as much as possible. So obviously you've got a cat there with social anxiety trying to blend in. So why are we talking about anxiety? Well, obviously with current situations, I think people are feeling a lot of anxiety. And when it becomes a problem or a challenge, students with anxiety often show more behavioral and academic challenges in schools. They tend to be suspended from schools more frequently, although we're not using suspension significantly in our district anymore. It's still the case that students do miss a lot of school. And again, they refuse to attend or will drop out of school. This can lead to lots of challenges in adulthood, with ranging from employment difficulties to problems with relationships, in extreme cases, addiction issues, possible incarceration, and suicide. Unfortunately, anxiety is one of the more common emotional problems in children. The overall rates tend to be about 20% of all children, so 1 in 5 kids are having some sort of mental health issue. A lot of that is anxiety, although other disorders are very common as well, and often disorders that co-occur, such as anxiety and depression, or ADHD and anxiety, are also very common. Unfortunately, a lot of our adults also experience that, a little less than 20%, 18.5%. Also experience that. And what we've found locally in our district is that when we've given a survey called the BIMAS 2, we've seen anywhere from 35 to 55% of students have reported significant or elevated levels of anxiety or depression. So considerably higher in local samples. Of course, some of those are kind of false positives and are probably less than that, but it's still quite high. Even at the lowest number. It's highly likely that given our current situations and the COVID-19 restrictions, that the anxiety is actually higher than even that. A lot of factors that we consider in this, that systemic racism, community violence, not being able to see other kids, all of those things are probably increasing the rates. In order to make sure that we're kind of keeping common language, I'm going to provide some definitions for you. First, we'll start off with stress, then worry, then anxiety, and kind of talk about the stress cycle. Let's start off with the concept of stress. Stress is a perception that we're unable to cope with the demands of the situation at hand. This means that something is coming at you and you don't feel like you can handle it, essentially. And so it's a physiologic response, often caused by a specific trigger to kind of a perceived threat. And I think it's really important to note that it is a perception and the fact that we're unable to cope with that. Worry, in contrast, is a process, cognitive process, that where people focus their thoughts on the object of the anxiety or stress. It's often very specific. And there are times when worry and actually stress can be very helpful as well for situations where preparing for situations where things could go wrong, or to make sure that we are doing the things that we need to do. The problem is that stress and worry can kind of grow too big and become more problematic. Our next term is anxiety, which, just like stress, is a physiologic body response to a perceived threat. However, the perceptions of the body response maintains after the imminent threat is gone. It's often a kind of a persistent or it involves excessive worries. It's obviously a long-term response to stress. The feelings, even though the threat is not there, there still can be intense feelings of fear, nervousness, and tenseness. Sometimes the anxiety can be diffuse as well. It's kind of hard to put into words. There's a general worry about something that bad is going to happen. Certainly anxiety and stress are normal and helpful at times, but we're going to talk about when it becomes more challenging in a few more slides. This slide talks about the stress cycle, and this is kind of a normal escalation cycle that people experience with anxiety or anger and aggression as well. We're also talking a little bit about fight, flight, or freeze, and I'll tell more about that when we talk about the sympathetic and parasympathetic nervous system in a later slide. But let's start off with the stress cycle here, and we'll talk about baseline. And this is hopefully where most of you are right now. You're sitting kind of watching this video kind of calmly, hopefully. Your blood pressure is down, is normal. Your heart rate is kind of in the average range. Your breathing is normal, and you're able to think and process information quite well. Unfortunately, sometimes something happens and we kind of go into the alarm phase. It's usually triggered by a perceived threat or some sort of environmental stimulus that's well, threat-inducing. And so we'll go into the alarm phase, and in the alarm phase, our heart rate goes up, our blood pressure goes up, our breathing becomes much more shallow and staccatic, and our ability to think rationally and reasonably goes down as well. Our focus becomes much more narrow, and we have more challenge with figuring out how to solve problems in our world. That area is where we go into fight, flight, or freeze. And fight and flight are two kind of things. If animals, if they perceive a threat, they're either likely to fight the threat or to run away from it. There's another one where animals will play dead, essentially. That's kind of the freeze. And so you'll see people sometimes kind of almost go catatonic in that situation. After every kind of alarm phase, it's usually a big expenditure of energy. And so there has to be some sort of recouping of that energy, and that's called the exhaustion phase. And in that situation, people are sleepy, they're tired, they might be still irritable, but they need to kind of retreat from whatever it is and be kind of in a quiet, alone area as well. This slide is probably one of the most important slides of the presentation tonight, because it really kind of gets at what anxiety is and how it becomes a problem. And the analogy that we like to use is the anxiety monster. We've got some pictures here from Stranger Things. We've got the Demogorgon and the Mind Flayer, the shadow monster there. Those are great examples of good monsters that are kind of amorphous and abstract. The thing about anxiety is that it's fed by fear. And so the monster grows in power by the more fearful we are of it. And what happens is avoidance and escape tend to make it bigger and worse. From a behaviorist perspective, anytime that you are reducing anxiety makes it more likelihood, it's kind of a negative reinforcement. And what happens is that you're trying to, anytime you see an anxiety situation before, you go back to what you know and what has worked in the past. And so by running away from the anxiety, it just kind of continues that anxiety. And really the only way to tame the anxiety monster is to stand up to it and to do what's called sensitization, where the monster in and of itself does not cause any kind of a physiological response. And we'll talk a little bit more about the kind of parasympathetic and sympathetic nervous system, but I think this is the most important thing that if I could teach parents and kids is that by running away from the anxiety, it makes it worse, which is really easier said than done, I recognize. But there are ways that we can kind of help with that. When looking at anxiety, it's helpful to have kind of a conceptual framework or a model to explain anxiety and to others and to understand it more fully. And the model I have here is called the cognitive behavioral model of anxiety. It also works for depression and other mental health issues as well. But what you'll notice here on the left here is what's called the cognitive triangle. And that's composed of thoughts, behaviors, and feelings. And obviously thoughts are the things that are going through your mind, and the obsessions and worries. Behaviors are the specific behaviors such as arguing or crying, or yelling or running away, all those things. The feelings would be a feeling of dread, kind of tense muscles, a sense of extreme fear, almost like a panic disorder. Those are kind of the feelings that go with it. What you'll notice there is that there are arrows going back and forth between the different concepts. And the idea is that each of these concepts kind of affect each other. So your thoughts can affect behaviors and feelings and all the way around the triangle as well. To give you an example of how that occurs, let's take current conditions of being at home and doing online schooling. You may have some students who refuse to engage in going to class or showing up to on cameras in particular. And it might be that the thoughts are, I didn't do my homework and my teacher is going to call me out in class and I'm going to be extremely embarrassed. Those are the thoughts. The behaviors would be either turning off the camera, logging in, and then doing something else, or not even logging in at all. Obviously, the feelings would be, if the student is presented with that situation and forced to do that, the feelings would be, increased heart rate, high blood pressure, probably some sweating, all of those things would occur. Now, there's two other parts of this that are really important. There's the cognitive distortions and reinforcement. Cognitive distortions are the unhelpful thoughts or kind of thinking errors that lead to the behaviors and the feelings as well. So in the example that I showed is that, everybody's going to look at me or think I'm weird, the teacher's going to call me out, or I'm going to be embarrassed because I didn't do my homework. Those are cognitive distortions. A teacher may be angry or frustrated, but usually they're not, and so they're unhelpful thoughts. That student may have had experience in the past where that unfortunately occurred, but in most situations, teachers are going to be very helpful and wanting to help the student in that situation. And what happens with reinforcement is that when a student thinks that, they engage in certain behaviors that help to kind of tamp down those feelings, and that works for them. What happens is that the behaviors that occur reduce the feelings, and so whenever those thoughts come up or the situation is presented, those behaviors and those thoughts have been reinforced because they reduce the feelings. It's kind of, in behaviorist terms, it's kind of negative reinforcement. You're removing an aversive situation, and that's likely to create that behavior to happen in the future. Let's delve into the more biological aspects of anxiety, which could be part of the feelings part of the cognitive triangle. There's two parts to the nervous system, our nervous system. There's the sympathetic and then the parasympathetic nervous system. And the sympathetic nervous system kind of causes the physiological arousal, which is responsible for fight, flight, or freeze. The opposite of that is the parasympathetic, which kind of counters the sympathetic nervous system. And so anytime that we go into a fight or flight or freeze or some sort of anxiety situation, it can take a little while for the parasympathetic nervous system to kick in, but eventually it will. That's important that we, when we look at different types of treatments, we're trying to engage the parasympathetic nervous system as quickly as possible. So in the cognitive behavioral model, I gave you some kind of feeling sensations related to anxiety. Here are some more specific ones. This is a pretty good list of that. Things that I didn't mention is nausea, trouble concentrating, jumpiness, dizzy, faint, lightheaded, things like that. This slide explains a little bit more about the thoughts that I mentioned earlier. Specific thoughts that thinking that danger is everywhere, or thinking that a single situation is very dangerous when it actually is not. There's often a concept of a faulty smoke alarm that detects smoke when there's not. That's often when an anxiety disorder occurs, is that our thoughts are not necessarily accurate to the situation. Other people can also worry too much. That can be a symptom of anxiety. And other people see thoughts or have thoughts and images of bad things happening. And they tend to be irrational or kind of unhelpful. So this slide goes deeper into the behaviors that kids often show, or people often show with anxiety. A real common one is avoiding situations. Younger kids will tend to, or even older people will tend to cling to safe people or refusing to leave them. You might get temper tantrums or outbursts from kids when feared with or faced with separation or the feared situation. Sometimes people involve rituals, particularly in a disorder called obsessive compulsive disorder. You may also see aggression, particularly if their escape avenues are blocked. You may get aggression. And you might also get oppositional behaviors where kids will refuse to do something because it causes them anxiety and they're not going to go there. This slide is really important as well because this lists some of the behaviors that you might see at home related to more significant anxiety concerns. So situations like isolating or arguing, avoiding people, places, situations, headaches or stomach aches. Those are called somatic complaints. Those are very common. A common one that I work with is also refusing to go to school or to engage in Teams meetings, since we don't use Zoom. But difficulties with transitions. Another one that I'm also seeing is excessive electronic device use. That also goes with gaming as well. Difficulties with going to bed, maybe going to bed and taking an hour or two to get to bed. Other things that just being very quiet, avoiding social situations, and fatigue. In the school setting, these are behaviors that we see that are often indicators of more significant behavior or anxiety problems. So school refusal, kind of avoiding to go to school or skipping classes, yelling and shouting at others, inappropriate language towards classmates, physical aggression, refusal to complete assigned work, non-compliance, a lot of these things, reassurance seeking, all of those. What you'll notice is a lot of these behaviors are kind of externalized in the sense of that they're acting out towards others. And the tendency might be to say that child is being annoying or irritating or a problem, when in reality, they're actually probably experiencing anxiety. And maybe the only way they know how to deal with it is by kind of pushing people away. Previous two slides showed kind of some more significant issues with anxiety. It's really hard to determine when it's really a problem and when you need to get help. And really the idea is that when it becomes a pattern and it starts to negatively affect a person's life. And when we consider what areas of life for kids, it's usually around academic and vocational functioning, kind of social functioning, physical health, and then play and leisure time. If a student is having lots of problems in these areas, then it's probably time to get help. And it's also important to note that behavior is on a spectrum and anxiety is on a spectrum. And so it really, some people may have a high level of anxiety, but it isn't really affecting maybe their academic or social functioning. And so they may not need that level of help. It's really kind of independent, and oftentimes it's if it starts to affect people's ability to get their work done or to have a kind of a high quality of life, then it's time to get additional help. When you go to get help, doctors will often provide diagnoses, and these are the most common kind of anxiety types or diagnoses that we see in kids. I'm not going to go over these. We are going to do a later or more in-depth discussion about anxiety in a future date, and can talk more about these, but those tend to be the most common ones. So let's jump into what causes anxiety. There's different reasons why it occurs, but there's four main areas, and I'll touch on each of those. So there's genetics, brain chemistry, and neurology, life situations and trauma, and then kind of learned behaviors. One theory of causation for problematic anxiety is that it could be genetic. Particularly, there's been some research done with twin studies on social anxiety disorder that showed a specific genetic link. And what happens is the twins are raised in different households, and they tend to have the same identical level of anxieties, indicating that there's some causal factors there. These genes tend to affect a chemical called neurotransmitters, which I'll talk about in just a minute. Another theory about how anxiety occurs is kind of through brain chemistry and neurology. And in this theory, there's problems with the biochemical pathways in the brain. And I won't go into too much detail about this because it's quite complex, but essentially there's a chemical called neurotransmitter, which helps propagate the electrical signals between synapses. And what happens is that in these areas, the neurotransmitters, there's either too much of them or too little. And it can cause either misfiring or not, or firing too much of the neurons, and that can cause problems there. Another factor along with this is kind of temperament, and temperament is kind of inborn characteristics of people. And what you'll notice is that if you have kids or multiple kids, you'll notice that some kids have very different personalities after they're born, and these are often related genetic factors, and the ones that are, the list there shows the different types of factors that have been identified in terms of temperament. But the ones that are really kind of important in anxiety is the approach and withdrawal, whether somebody is willing to approach a novel situation or a person or withdraw immediately from that. There's some inborn characteristics about that. Adaptability, how well somebody's able to adjust to novel situation. The intensity of the reaction, so do people kind of respond in a mild-mannered approach or have a large blow-up? And then overall mood is affected by that as well. The next theory about how anxiety comes about is kind of trauma, relates to trauma and environmental causes. There was a study a number of years ago done on adverse childhood events. They're also called ACEs. And these are situations that have affected people, things such as the death of a parent, substance abuse in the house, witnessing a traumatic event, things like that. And what they found is that these situations have a long-lasting impact on how people react in the world. It also can lead to disorders such as post-traumatic stress disorder or PTSD. And then lastly, in this page, brain trauma. So any CTE, which is kind of a newer diagnosis with head trauma, any tumors or lesions can also cause an increase in anxiety. The last causal theory that we're going to talk about is the reinforcement approach. In this approach, I talked a little bit about it with the cognitive triangle, is that consequences, either positive or negative, affect the future behavior. So if a student is engaging in a behavior that escapes from the anxiety, such as that student walking in the hall, kind of running back into the classroom and saying, I'm not going out there, what happens is that doesn't cause the anxiety to go down. And with what I showed with the anxiety monster analogy, it just kind of continues to feed it. And that's a problem. I really want to highlight this as one of the more important slides. I think this one and the anxiety monster are probably the two most important slides, is that kids who show the anxiety may show very irrational thoughts and behaviors and really challenging behaviors, arguing, screaming, crying, maybe even fighting. But it's all because they're terrified and don't want to engage in the behavior that is expected of them if it's anxiety related. Sometimes it's not, but if it is anxiety related. And it's important for parents to not allow the student to give in to that anxiety monster, because if they do, it's important, what will happen is that will reinforce that in the future. Now that's easier said than done. And you want to do it with love and kindness and compassion. And sometimes it's really hard to do, because sometimes you don't feel that way when it's you're stressed out yourself as well. I'm going to pass it off to Lane, and she's going to help show you how to help in those situations and give you some ideas and suggestions to not give in to the anxiety monster, and also do it in a way that kind of maintains respect and dignity for your student.
Hi everyone, my name is Lane Barker and I'm a school psychologist and member of the mental health assistance team. And now that Jared has talked a lot about what is anxiety and its causes, I want to move into discussing what are ways we can help. We're going to talk about some general ideas and focus mostly today on what you can do to support your child with anxiety in the home. We're going to talk a little bit more about what the school district is doing to support students experiencing anxiety, as well as community supports and services that are available. General therapeutic approaches that are included in most effective therapies include education, providing your child with information about what is anxiety and how it might affect your body, how it might affect your emotions, and how it might affect your behavior. We always say you got to name it to tame it. You need to understand what it is and how it's affecting you in order to change your behavior and do things to feel better. Cognitive reframing is another skill that we'll discuss later, which involves thinking about thinking and trying to think in a more helpful way. Relaxation and emotion regulation, doing behaviors in your life to help yourself feel calmer, modeling those behaviors for your child, helping your child engage in those behaviors when they are seeming anxious or upset. Healthy lifestyle and routines, which we know are really important. If we feel good in our body, we're more likely to feel good in our emotions and in our mind, as well as, lastly, the most common and effective clinical component of treatment is exposure. And we're going to talk about some ways to ensure that we are doing exposures in our home with our children when they start to have an anxiety behavior that's getting in the way of their functioning. The first component that we're going to talk about with supporting your child with anxiety at home is education. The key to educating your child about anxiety is to provide information in a developmentally appropriate way to help them understand the experience of anxiety, to help them learn the vocabulary of anxiety so that they have the words to describe the way that they are feeling, for them to understand that anxiety is normal, common, and that it does get better if we work through it together. So the question now is, how do I help educate my child about anxiety so that they can tame it themselves and recognize that it's happening? This slide has some really great resources to do that. Younger children respond really well to children's books. This slide has some great options for you. In these stories, the focus for all of these children is that they were experiencing something they were very anxious about, and they get brave and face up to their fears and work through the thing that they're anxious about and find out that it's just not as scary as they thought it would be. And that really is the key to supporting children with anxiety, is facing up to your fears, not letting that anxiety monster get bigger. And these stories do a great job of explaining that. We also have some YouTube videos here for teens as well as younger kids that explain the experience of anxiety in my body and in my mind. There are some great websites here with resources for parents and kids understanding anxiety and how it affects a person, as well as there are some awesome apps that include self-calming strategies and some education about what anxiety is and how it affects you. The real key here as a parent is that if you're noticing your child experiencing anxiety, providing them with some education about what it is, how it feels, is how we start to identify that it's happening and that our child can do something to feel better, or we can support our younger child with doing something to feel better. I want to come back to the cognitive triangle that Jared explained earlier and start talking about what we can do to support our kids with anxiety in each corner of the triangle. So the first one we're going to discuss is thoughts, thinking about thinking. Often kids experiencing anxiety and adults experiencing anxiety are engaged in what we call cognitive distortions, thinking that is way out of proportion with what's really going on with the situation. One common way of engaging in a cognitive distortion is having a thought that's a catastrophe, catastrophizing. This is the worst thing that can happen. I never get what I want. This always happens to me. Other thinking traps include mind reading. I know she's judging me. I know they don't like me. As well as fortune telling. I know what's going to happen in the future. I know I'll fail the test. I'm sure that this is going to go poorly. These types of thinking are really common when we're experiencing anxiety, but are also often untrue and definitely unhelpful. If we're thinking that everything's going to go poorly, it certainly isn't going to help us feel our best, and it often will impact our ability to behave or perform. And so starting to tackle these thoughts and change these thoughts is the process of cognitive reframing. Helping our kids to start picking apart their thinking and come up with more helpful and more true thoughts is the process of cognitive reframing. Some ways that we can do that are, let's take the example of having to give a public speech. If I have to give a public speech and I'm nervous about it, I might be thinking, I am the worst at this. I always clam up and struggle to get my words out. What if I go blank? Everyone in there is going to be judging me and thinking that I'm terrible at this. If those are the types of thoughts I'm having, I'm likely to feel anxious and tense and nervous, and I'm likely to be more tense when I'm giving my speech, and I'm more likely to forget what I was going to say and clam up. So in order to perform better, I need to try to think better. Ways to do that include, I could start asking myself some what if questions. What if it goes better than I thought? What if there are other potential ways it could go? And starting to introduce some idea that Perhaps there are other outcomes than I was thinking when I was thinking it's definitely going to go horribly. Other things I could do are examine the evidence. I could write down on a piece of paper evidence that it's true. I'm the worst public speaker in the world. Well, I did give a really not great public speech a few months ago, and I just stumbled over my words. But you know what? I did fine on this other public speech I had to give, and I presented to my peers a few weeks ago, and that one went okay. Well, maybe the evidence shows that it's not my strength, but actually I've performed well in the past, and I probably can again. The best friend test is another way to look at our thinking and determine whether it's helpful or true. If I think about, would my best friend tell me I'm the worst public speaker in the world and they know I'm going to do terribly and everybody's going to judge me? Probably not. My best friend would probably give me more grace and would probably be more supportive in their thinking. And if my best friend would talk to me that way, then why would I not talk to myself that way? A best friend would probably tell me, yeah, it's not your strength, but you did fine last week. You're going to do great. And if I listen to that voice and tell myself that thought, I'm more likely to perform my best. The key here is really that humor can be helpful and to try to help ourselves come up with more positive thinking. I always talk with students about, for example, if Michael Phelps were standing on the blocks ready to do an Olympic race and he were telling himself, I know I'm going to fail, that just seems ridiculous, right? And so he's probably thinking more positive and more helpful things and cueing himself for things that he knows he needs to do to succeed rather than focusing on that he thinks he's going to do poorly. And really the key to this as a parent and teaching this as a parent is modeling it yourself. If you experience a setback in your day or in your life, or if there's something coming up that's causing anxiety for you, you could walk around the house feeling anxious and struggling with that emotion, or you could talk about it out loud and really model your experience. I'm really nervous about this thing I have for work or something that's coming up for me. And you know what? I'm thinking this. I'm thinking really catastrophic thoughts, but those aren't helping me very much. I'm going to think about this differently. Here's a different way I could think about it. And doing that in front of our kids helps them to see the process of reframing their thoughts, examining the evidence, doing the best friend test, and hopefully coming up with a more helpful or true thought that they can move forward with. The next component to supporting your child who's experiencing anxiety at home is relaxation and emotion regulation. And on our cognitive triangle, this is the feelings part of the triangle. Doing relaxation exercises helps us to engage that parasympathetic nervous system in order to calm down the physiological experience of anxiety. One way to talk about anxiety or the level of anxiety that your child is experiencing is by using a fear thermometer or a subjective units of distress scale, or SUDS. This one below is a 1 to 10 scale, and it's pretty typically used in clinical settings, but I also encourage families to use it at home. It's a really good way to get a quick gauge on how your child is feeling, because if your child is in this kind of 6 to 10 or 7 to 10 range of experiencing anxiety, it's not likely that changing thinking is the best first step. If we're physiologically so elevated and upset that we're in this kind of 6 or 7 to 10 range, it's likely that we need to do something to calm down and feel better first in order to then engage in some other strategies to feel less anxious. Here are some strategies for engaging that parasympathetic nervous system and helping our child to feel a lot calmer. Distraction is one. You can watch a video, shift talk to something else, get up and change your environment, do something to sort of change the way of thinking and move on to something else. This is okay in the short term when your child is feeling really distressed in that 6 or 7 to 10 range. Again, in the long term, we want to face up to fears, but if we're so distressed that we can't really think straight, this is the time to do some distraction and calming, and it's absolutely okay. Other tactics involve deep breathing, taking deep breaths in through the nose, expanding the belly, and spending time breathing out as long and smooth as we can. Progressive muscle relaxation, which involves tensing the muscles and then releasing them sequentially and focusing on the sensations in our body to reduce the feeling of anxiety, as well as guided relaxation and visualization. The links on this page take you to good examples of all of those types of things that you could work through with your kids. Tackling the behavior corner of the cognitive triangle involves helping our kids to engage in healthy lifestyles and routines. Sleep is one that we're seeing is really problematic, especially for our teens right now. We have a lot of students staying up till 4 o'clock in the morning working on homework, getting up for class at 8 a.m., and then taking a 3-hour nap right after class. And I'm sure many of you have seen that in your kids. While they feel like that works for them, what it's causing is kids who are not getting enough sleep at night and for a long enough duration in one go, and kids who are feeling tired, kids who are having trouble paying attention and having trouble with memory. So if we can help our kids to engage in healthier sleep routines, they will feel better. Healthier sleep routines involve trying to get at least 9 hours of sleep at night in one go, avoiding those naps that kind of reset our cyclical sleep schedules, and having a consistent bedtime routine and a consistent bedtime. Now, I know these are a hard sell with teens, but if your kid's walking around feeling tired, it definitely will support them to try to help them come up with a reasonable sleep routine that they can try. Healthy eating, regular exercise, and helping your kids continue to engage in fun activities and things that bring them connection with their peers and community are also really helpful ways to keep our behavior in line so that when anxiety producing things happen, we're ready to cope and ready to deal. The final component of supporting your child who's experiencing anxiety at home that we're going to talk about today is exposure. In a clinical setting, exposure is used to help the child or teen or even adult to take on and face up to their fears in a sequential and loving and careful way in order to sort of retrain their brain that the things that they fear are not as scary as they thought and they can make it through these things. We can integrate parts of exposure into our everyday lives at home, and I want to give you an example of how this can be done. It's really easy as a parent to watch your child experience anxiety and distress and to want to take that distress away right away. Trust me, I know. But when that anxiety starts to get in the way of our child's functioning, we can't avoid that thing anymore. And so I want to tell you a little story about that. My young child, Sydney, was experiencing extreme anxiety over this white wolf that you see on your screen. It's like an animatronic wolf that they had at Home Depot. Our family was renovating part of our home last year, and we had to go to Home Depot a lot, and this wolf was terrifying her. And it got to the point where she was bringing it up at various times of the day when we weren't anywhere near Home Depot. Every time we got in the car, she was afraid that we might be going to Home Depot because we might see the white wolf. It started to really get in the way of our lives because we needed to be able to drive in the car and we needed to be able to go to Home Depot. We were renovating our house. So instead of telling our kid wolves don't exist and removing every stuffed dog toy in our house and putting our dog up for adoption that we have at home, we realized we have to tackle this fear and we have to start exposing her to it so that she eventually learns that it's not as scary as she thinks. So what we did was we started talking about the big white wolf at home and how we're going to tackle this fear. We made it funny and talked about how it was so silly that it's not real. We talked about that it's just plastic and wires inside and that it's not a real wolf. We started to look at pictures of the wolf until we became comfortable with that. And we eventually worked up to going to Home Depot and seeing this wolf. Now, this is sort of a silly example because it's a, doll at Home Depot. But the reality is that if we had taken away those things that were causing anxiety for our child, we would be more likely to cause that anxiety to grow. And she'd be likely to then move that anxiety to other stimuli in her life, other things that are like wolves, other experiences that cause fear. She would learn from those experiences that she should avoid them and put them away. And instead, she learned to face up to her fear to this wolf, and now our family can go to Home Depot again like we need to be able to do. The key here is that, again, it's really easy to watch your child experience anxiety and to try to reduce it for them, to try to take away the stimulus that causes anxiety for them. And the reality is that that's not helpful in the long run. It helps your child feel better in the short term, but in the long run, our kids are learning that when we're anxious of something, we have to run away from it. And it can really affect long-term life consequences. So helping our kids to face up to fears by exposure in a kind, loving, and supportive way It's how we help our kids eventually learn to work through all their fears that come up in their life so they can be courageous and live long and successful lives in the world by tackling things that make them anxious instead of running away from them. Medication can also be a component of treating anxiety, especially when strategies in therapy and at home have not been as effective as hoped and the child is still experiencing clinical levels of anxiety. The best outcomes in the research for treatment of clinical levels of anxiety involve medication as well as cognitive behavioral therapy together. Medications prescribed for anxiety are typically SSRIs and should be provided under close supervision of your physician or psychiatrist.
From a school perspective, these are some ways that we can help with students who have anxiety. There are kind of basic services such as clubs, organizations that can help with the social aspects and kind of help kids that way. We do have tier 1 kind of SEL standards and lessons. We have school-wide PBIS. Right response is a way of helping adults to work with kids. We have screening processes, variety of those. Obviously, each school has counselors that can provide brief kind of support as well. We also have at the high school mental health services through our MHAT team, as well as our community mental health agencies. And then lastly, for students who have more significant emotional challenges, we have our disability services, which would be a 504 plan and special education. This is a list of very specific Bellevue School District initiatives that we're taking on to help with mental health issues and concerns. Each of our health classes at 7th and 9th grade is looking at mental health in their units there. They're also doing the signs of suicide curriculum with that. And each class also across the whole spectrum is looking at the SEL standards and common lessons. Second Step and Ruler are part of that as well. As I mentioned in the previous page, the Mental Health Assistance Team is a group of students that works with a screening tool to identify students with specific needs and offer them support at a high school level. And then PBIS is another approach that our district is using.
Community health agencies are often a great place to start if your family is seeking counseling or support for yourself or your child. Many of the community agencies located in Bellevue are listed on this slide, and the links will be available to you in the slideshow later. These services provided by these agencies are often provided at free or low cost based on your family's ability to pay and health insurance status. Private agencies are another great way to seek counseling services if you're noticing anxiety in your child. The best way to access private agencies is usually to see your pediatrician, let them know what you're experiencing, and ask for their recommendation for who to see and where to go. Your pediatrician can usually make recommendations for providers who use health insurance that are in your network. Some key things for families that we suggest is anytime you're seeking therapy, to give it a few sessions to see if the counselor is a good fit. Sometimes kids can be resistant at first, but they really buy in once they've tried it a few times. Also, focus on finding a provider that uses evidence-based practices such as cognitive behavioral therapy, and the key component that should be involved in any therapy to tackle anxiety is exposure. If your therapist should have a plan for how to support your child in facing up to fears. The most effective therapy often includes parent and family involvement, and so when you're looking at therapists, also be looking for that. To summarize what we've talked about today, we just want you to remember that anxiety problems are very common in kids and teens. If this is what you are experiencing at home, you are not alone. And with home supports, school supports, therapy, and medications, kids get better. The last thing we want you to remember is the only way out is through. Avoiding things that make us anxious only tend to let the anxiety monster grow. Facing up to it and working through anxiety is really how we improve in the long term.
Okay, before we start the panel discussion, I just want to make sure you're aware that we are offering a follow-up small group session for those of you that are interested in diving a little deeper on the topic of how to support my worried, anxious student. It's scheduled for Wednesday, December 2nd at 5:30. So if you're interested, a pre-session registration is required. So please complete the registration form located in the group chat right now. I believe that Gargi is going to drop it into the chat for all of you to complete. And as we get closer to December 2nd, we will reach out to you to send you an invite to that, that second smaller group session if you're interested in doing that. Now let's start our panel discussion. Question number 1 is going to go to Carol Johnson and then to Jared Taylor. So I'm going to go ahead and ask him that. Then question number 1, how do I tell that my kids are experiencing anxiety? And then a follow-up question to that is, how do I get help for them? So Carol Johnson.
If your child is experiencing anxiety, more than likely it is impacting you in a huge way as well. Children who tend to worry are almost held captive by their fears. They'll go to great lengths just to avoid interacting in any frightening situation. They will often ask a ton of repetitive fear or anxiety-based questions. And even with your best answers, you're not able to relieve or saturate that need for reassurance. As parents, you may find that you're spending a lot of time just reassuring and coaxing and accommodating and doing whatever you can to minimize distress. And you may notice that you're getting a little bit exasperated, and sometimes it's just hard not to be angry or frustrated with the level of need that they're exhibiting. The list of behaviors that Jared went through too are also just key signs that something's up with your little one. I love what Lane said, it was just to lean into and access the supports that are out there. And there's, I think we'll go through some more resources and ways to use them, but you are usually pretty aware as a parent when something's not quite right with your little one.
This is Jared. Sorry, I wasn't sure if I was supposed to be cued or not. So hi, thanks for joining us tonight. I really appreciate you being here. And I've kind of talked a little bit about from the secondary level, so from middle school and high school, kind of what behaviors to see, to look forward, or not look forward, to look at. What I experience mostly is less kind of externalizing behaviors. Sometimes the externalizing, the questioning, and more refusal behaviors look different than at the elementary than they do at the middle school and high school level. We often get more shutting down behaviors at the high school level, in particular in middle school. Like particularly right now, one of the major signs of anxiety and or depression, they often go together, is just not showing up for going to classes online, not turning in work, minimal communication between you and your child. Childs may kind of barely acknowledge your existence at times. Sometimes substance use is very common as well. I think Lane mentioned in the presentation that distraction is a common technique to kind of avoid. And the best, in adults and older kids, alcohol and drug use is a big way of distracting oneself from things that are anxiety provoking. They provide a short-term kind of cure, so to speak, for that. And so that's a sign if your child is smoking marijuana or drinking alcohol on a consistent basis, that is often an indicator as well. I'm trying to think of any other thoughts. Anybody else have any other thoughts about that? Okay.
Okay, question number 2 is going to go to Carol first and then to Lane. And the question is teletherapy as effective as in-person therapy? Carol?
Yes, for the younger ages, I actually asked some of my kids about this, and there's different levels of responses. There's great value when you can sit down next to someone and you can talk with them and you get a chance to just engage, and there's so much that's tangible and play therapy oriented with the younger ages. That's hard to duplicate in an online therapy, teletherapy type session. However, when I talk with kids, sometimes it's easier when you're in your own space and your own surrounding to be able to be comfortable and to be able to open up and share in ways that happen a little bit quicker online than may happen in an office or a clinical setting. So there's arguments for both on this. I've also just noticed from a parent perspective that sometimes the teletherapy is nicer because it alleviates one more element of commuting to an office or sitting and waiting for your child to finish, and it allows you to engage really efficiently and quickly with the therapist. That's really helpful in those ways too. So I think there's great advantages to just reaching out and getting the support. I also know, especially with the younger ages, that the benefit of therapy, there's so much that comes at you that as parents, I don't always know how to respond, and I don't know how to answer questions. And so to be able to reach out to someone to coach and to guide and to encourage me on how to respond is worth their weight in gold, and knowing how to best support my child as they're navigating all the different things that are creating anxiety in the space that they're in.
Elaine, are you ready to respond?
She's muted.
I forgot I had to unmute. Hi. Just to piggyback on what Carol was saying, a lot of those things are also true for our older students. When I've been speaking with our secondary students, they are sharing some very similar things, that there sometimes is some value lost in not being able to sit right next to your therapist and share with them on a more kind of human level. But for many of our students experiencing anxiety, especially when that anxiety is keeping them from attending things and going out into the world in a confident way, teletherapy is reducing some of those barriers for kids and making therapy easier to attend. Most of our community agencies that were shared on that slide, and I know we went through some of the slides with links pretty quickly, so we will make those available to you following the presentation. But most of our community agencies are offering both in-person and teletherapy options right now. And so working with your therapist currently, if you're seeking one, to figure out a plan that's right for your child is really recommended. As well, there's somewhat a limited body of research determining whether teletherapy is as effective as in-person therapy, but the information that is out there, currently the research that's been conducted is showing pretty strong evidence that teletherapy is as effective as in-person therapy for anxiety treatment, trauma treatment, depression treatment. And within the district, as a provider of mental health services to kids who's been providing teletherapy services since, March of last year, I can say that the evidence is pretty strong within our district as well, that we are seeing kids make great progress within a teletherapy format. So what I would say is that if you're thinking about reaching out to access therapy services for your child, don't let the sort of fear about teletherapy be a barrier to you. We're seeing really strong evidence that it's working for a lot of people.
Okay, question number 3 is going to be for Carol and Jared. Question number 3 is, how successful is treatment for anxiety? Carol?
This is one of the most exciting things, I think, with working with kids that have a diagnosis of anxiety, is that there's such great success, and the tools that they're able to use are easy to understand and easy to practice and easy as a family unit to work through. And so anxiety has great success, and it's always so encouraging, both for as a counselor, but also as a parent.
Yeah, at the secondary level, I would agree. that the success rates are quite high when we look at mental health treatment rates in general. Anxiety is one of the most common forms of mental health issues, and it is one of the most understood in terms of mental health disorders. And the treatment really is, the primary treatment is exposure. Medications can help if students are having troubles with getting even to the exposure phase, but even exposure in and of itself can do almost as good as medications in many respects. From a local perspective, Lane and I are part of the mental health assistance team, where we're doing a lot of work using cognitive behavioral therapy for students with anxiety, depression, and trauma. And what we're seeing across the board is about a 60% improvement rate for all the kids that we're working with, which may not sound great, but in terms of mental health interventions, it's actually quite good. When we look at normal improvement rates are about 20 to 30%. When it comes to certain other treatments as well. So it's the good news about anxiety and anxiety disorders, and what we try to really stress in the education component is that there is help, and the help does work.
Okay, and our last question goes to Carol and then to Lane. What are some good books or resources you would recommend to learn more about supporting my anxious child?
At the elementary level, I've really liked the book that was showed as a resource in the slideshow here, and that's What to Do When You Worry Too Much, A Kid's Guide to Overcoming Anxiety. And this one is written by Dawn Hubner. What she does is just really utilize the tools both Jared and Lane explained on teaching kids tools to contain their worry, and you'll see terms like worry boxes or worry time or talk time, which, if worry is used in the analogy of spilled milk in the refrigerator, when it saturates and spills and drips off of everything, it's super overwhelming for everyone in the household. But if you can contain it into a container and put it in the back of the shelf, that impact is far less significant than when it's all over the place. So the idea of containment, they'll also teach externalization, where you give worry a shape or a form, and when you do that, oftentimes they'll use the worry monster, and you'll see that in the book Worry Says What, and the picture on the front has a worry monster that young kids can really identify with. And then you can teach skills for them to talk back to the worries, or to tell the worry that you're not the boss of me, and you can't control me, and I may not be able to do this yet, but I will. And it puts into action some of those statements that give kids strength and power in learning how to control their own worries. And over time, as they engage in positive activities, which is another skill they talk about on just distraction or external demands, that you can fill your life with positive, healthy things and not give worry so much time and attention that your worries actually become smaller and your life is full of really great things. This book here, I've had several families read it a little bit at each night as a family, and just talk through the different activities, or do the different, whether you do the drawing or whether you just use the time just to talk through it. It just have been really helpful for families to understand where their kids are coming from, but also for kids just to be able to share their perspective on what they're worrying through. So it's been one that I've used in small groups, and families have used individually, and it's just been really helpful.
A book that I recommend is not necessarily specific to anxiety, but it's sort of a book where if you're starting to worry about anxiety or depressive thinking or behaviors creeping in, it's really designed for all ages of kids, and it's called The Optimistic Child, and it's by Martin Seligman. It's a great book that sort of helps to think about how we're inoculating our kids against pessimism and against negative thinking, and providing them with exposure to opportunities to have to persist through things that are hard, and really praising and supporting them in doing that. Seligman is a big proponent of learned optimism, right? That we can learn optimistic thinking, and really that's what we're talking about in this presentation as well, right? Is learning to change our thoughts to more helpful and true ways of thinking to support the way that we feel. And so that's a great book for parents that specifically kind of talks to doing that process and framing it, and modeling it yourself in your home. And I think Jared had a couple of other recommendations that were specific to anxiety for older children.
Yeah, for those parents that are having challenges with getting kids to school, either showing up or when we're back, I suspect that once we're back in school, once we have a vaccine that is effective and we're able to come back, we're probably going to see a lot of kids refusing to go back to school. I anticipate that. And so a great book for that is called Getting Your Child to Say Yes to School, and it's by Christopher Kearney. And Christopher Kearney is one of the leading researchers in school refusal and how to help with that. And it's a very parent-friendly book. He's also got some more in-depth manuals for practitioners as well that I've read and used quite a bit. Another one kind of similar to what Lane was saying, that's not necessarily for anxiety, but it does help with social emotional functioning, is called Strong Teens. And trying to remember who the authors on that, who the primary authors are, but Hill Walker is out of University of Oregon, and he's done a lot of work over the years with emotional and behavioral disabilities. And one of his proteges was Laura Fjorborn, who was in the Bellevue School District a number of years ago as a psychologist and is an excellent researcher and author. She's a co-author. They're not the primary authors. I'm trying to remember the other ones, but we can get that out there for you as well.
Okay, well, thank you very much for being patient with us. I thought that we were going to be able to drop the link for the small group into the chat for you, but unfortunately we're unable to do that. But what we will do is that we'll make sure that that link is available for you to let us know, express your interest for the December 2nd small group session. We will put that on our website probably sometime tomorrow. So please look out for it. We would love to have you join us for a deeper dive, a more in-depth discussion about anxiety, and maybe perhaps you have very specific questions regarding your student, and Jared and Lane will be the ones that will be facilitating that, and they can provide some consultation for you in that regard. So that is about the small group session for December 2nd. I just want to say thank you for joining us this evening for this virtual community forum on anxiety. I hope that it was helpful, that you learned at least one thing, one takeaway that you could use to support your student. I want to take this time to thank just a few people that, to help make this happen. First, I want to thank our fabulous presenters, Jared Taylor, Lane Barker, Carol Johnson, and then our Community Forum on Mental Health Committee members. There's many members on that committee that work together over several weeks to make this happen and the series of these forums happen. But I would really like to especially thank Gargi Trishelle, who is behind the scenes. She probably was having a little bit of anxiety at the very beginning when we were having some technology glitches. So we just appreciate your grace and your patience with that. But we truly appreciate all of her help and support. And then to all of you, thanks for attending. Be safe, be healthy, and we hope to see you at our next community mental health forum. It's Wednesday, December 16th, and it's at 4 o'clock. And it is about depression. So it's how to recognize and support my student experiencing depression. So we hope to see you then. Thank you, and have a great evening.